Hey there, many of us are aware that antibiotics are overused and sometimes inappropriately prescribed. But what a lot of parents don't know is that antibiotic use can be associated with your kids' behavioral and mental health problems. Did you know that even just one single course of antibiotics can significantly increase your child's risk of anxiety and depression? And antibiotic use has been associated with disruption of the gut microbiome and a higher risk for ADHD, anxiety, asthma, eczema, autoimmune illnesses, even autism. I'm Dr. Lisa Song, an NYU, Stanford, and UCSF trained holistic pediatrician and pediatric functional medicine expert. And what I want to tell parents is really understanding what antibiotics do to your gut microbiome. Now, of course, there's a time and a place for everything, and antibiotics can be life-saving, and sometimes your child may need antibiotics. But if your child takes antibiotics, just recognize that antibiotics are not selective. They're going to kill all the bad stuff, but they're also going to kill all that good stuff, all those good probiotics in your gut. And when we have an imbalance of bugs in our gut, that can lead to immune system problems, brain problems, and even hormone problems. So what can we do? Well, a few simple things. When your child does need antibiotics, make sure that they're also getting probiotics, getting back in all the good stuff. Now, you can take probiotics as a pill, as a supplement. If you do take that, you want to make sure that you take your probiotics at least an hour or two away from the antibiotic dose. And getting your fermented foods like pickles, real pickles, sauerkraut, miso, kimchi, yogurt if your kids tolerate dairy. So fermented and cultured foods that will get in those probiotics are actually going to give you much more bang for the buck than any probiotic supplement. The other supplement that's really very important, well, there are two, is glutamine. Glutamine is an amino acid that helps heal the gut lining, so very important after antibiotics. And also zinc. Now, your child may not necessarily need extra zinc, but you want to make sure that you're getting in zinc-rich foods, because zinc helps also heal the intestinal lining and the damage, the inadvertent damage that might be done after antibiotics. So zinc-rich foods include pretty much any animal protein, chicken, shellfish, beef, pumpkin seeds, nuts and seeds are a great way to get in zinc. Any of your beans, legumes are a great way to get in zinc, your green leafy vegetables. So focus on getting in zinc-rich foods, and that also will help you make sure that your child can get the benefits from antibiotics with killing whatever bad bacteria is in their system, but not any of the other unwanted side effects.